Kani kadega Batesi TV, bat pidang pet yaki kubor baman kasni, balawan rasha pi da ka Orange Nissan, lom so po niya Fabricate Shillong, ringkat bat ka BDW International School Nongmansong, Langkarding Shillong. Admissions open now.
Menteri Rang Baka Jelau Conrad ke Sangma wilayah tu baka jing penjariya Korphiw Paidbah haka Sngi Saitjaiñ kata haka arpoi tere ulber arajar arpo kalong tang ban chemi kilat Ïada kanang ban pensu thu shi Paidbah nong song snong jong jela bat hakari India halor ka jing shem ya kilat Ïada hi de ki Paidbah na uknyang jing pang coronavirus. Haba keren chino thok khubor hadin balawai ka jing lang kun hun menteri Menteri Rang Baka lo ong bakam dei setia ka jing khang nak benta ka nu jing Henry ka dei tang kala Ïada baka sorkar ka shem nak benta ban pensu thu ya ka jingma nak jing pang coronavirus ni yak belatib ru kom ka coronavirus awareness day nakaliang jong menteri Rang Baka jela ula kerpat ya ki Paidbah nong song snong jong jela barok kawe pakin ai ka jing trelang baka sorkar hak ni ka jing penjari ya ki Korphiw Paidbah bat aka juga poro kenturu iki Paidbah pakin long ki papet ngor haba ki let jing let akin hi khat saus ngi shabari ni shabar jela bakin wan shakman ban pentip dak bapan jing rap dak ba telefon hau number 108 ni dak ba register online lani telefon ya ki office control room haki office jong ki deputy commissioner ki badan haki district affair.
India as a whole has touched almost 225 cases as we speak, and we have seen a spike of almost close to 200% in the last 10 days. And out of these cases, about 55% of the cases have been people who have come from outside, and that means who have travelled from abroad, and 45% of the cases have been mainly local people who have been affected. India is at stage 2, as you're aware, and so keeping that in mind, today in fact at 4 o'clock there was a video conferencing where the Honourable Prime Minister and officials of the Health Department of Government of India and Chief Ministers of different states, all the states were present, and we had a 2-hour long meeting on the different steps that have been taken by Government of India, and also different measures that are to be done and taken up by the states in respect to the current situation that is the world as a whole is facing. Coming to the state of Meghalaya, friends, as you're aware, as of now there has not been a case that has been identified, not a single case that has been detected in the state, and therefore it is the right time, I should say, for us to take all the precautions and advance measures, learning from other states and other countries, and ensure that we minimize the impact in every sense to our state. And keeping that in mind, a number of steps have been taken by the government of Meghalaya, including closing down institutes and schools, colleges, and also asking everybody to cancel all kind of public programs, so that we avoid any kind of crowding and we're able to maintain social distancing. And apart from that, as a state, we also realize that if any situation will come, it will come from outside. So therefore, keeping that aspect in mind, we are also working on ensuring that a very strong mechanism is put in place, which we've already started working on. In fact, at a very advanced stage, and it should be activated tonight. But manual systems are already in place, where we are keeping track of as many of the students or people working outside, who are coming back home. We are trying to ensure that we are able to track them. We are, as of now, we know that about close to maybe 2,000 to 3,000 students and people working outside in other parts of the country, and some outside the world, outside the state, and some outside the country have also come back. And therefore, really our objective is to ensure that obviously that they're safe. It is also to ensure that they are made comfortable. It is also our endeavor to ensure that the right advice is given to them on how they should take care of themselves and take care of their family members. So I think it's important to put a mechanism in place that is going to continuously reach out to individuals who have come in from other parts of the country and from other parts of the world, who have come back home obviously because of the situation. But it's important that we, as I said, comfort them, guide them, and monitor them. So I think that is what our objective is. We appeal through the press also that all the individuals who have come back, you don't need to worry. It's just being done as a precaution. You just need to inform so that our medical volunteers can simply monitor, call you, and that too on the phone, and just to monitor and keep a track of how things are, and also, as I said, to guide you on what are the things to be done and not to be done. We have a number which is 108, which is already active, and people can simply call in that number and give their name and information on that. At the same time, by tonight or maximum by tomorrow morning, we also have an online registration system that is on, where we urge people go online and you can register yourself and inform us, so that further we can contact and guide you accordingly. So that system should be up, and I think when our message is going from the government side at 7 o'clock, is it? Or 8 o'clock? 7 o'clock. In that we will be giving the entire details of what the website will be. So as it's not up yet, so I don't feel appropriate to announce it right now, but it will be announced in that message. We just want to know the people who are coming from outside. Our local people who are studying outside who are coming back home. The call is being made only to register your name, and once your name is registered in the system, and there will be a code against your name, so we will just inform and get the details. Post that, our medical volunteers will call the concerned individual. Simple. You stay at home, you don't have to go anywhere, and they will just tell you what to do and what not to do. It's an advisory we'll give you on the phone. And then for the next 14 days, our medical volunteers will track you and monitor on the phone. Every day, we'll call you and say, Mr. A, Mr. B, are you feeling okay? How was the day? You don't have to worry. I hope you're maintaining social distance. I hope you are, as much as possible staying in your room. So it is only on the phone that you will be given advice. And this will help us actually, from the government side, will help us track things. And it gives a confidence building to all of us to know that we are monitoring the entire situation. So as I said, once we are able to track these individuals who have been studying outside and or working outside and have come back, and if you're able to track them for the next 14 days from the day they come in, and we are able to ensure that they don't develop any symptoms, we can be quite sure that nobody will be infected by it. So after thermal scanning, if there is no symptoms, the person is allowed to go and the person goes back home. But the reason why we're doing this, again, I'm repeating myself, is because the symptoms take 2 to 14 days to develop. So the person could not be showing anything on the thermal scanner, but then we need to watch the person for the next 14 days. And that's the reason why we're only saying, and as I said, we're not going to do anything to the person. We're not even going to ask them to go isolation, nothing. Self-isolation in the house, at your own place, at your own comfort. But what you have to do during that isolation, sometimes some of our people might not know. And obviously, they will not know what does self-isolation mean, how to do it, like simple things like using your towel. Make sure that you don't use, allow others to use the towel they're using. Avoid sitting, in one chair you're sitting, remain in that chair. If possible, the food should come to you in your room. That's simple steps which we feel that we need to tell those people coming in, and that's it, and we just monitor them. So that the whole purpose of this whole thing is, if you can track these 3,000 people, they go home, they come, they land, they go home. If there's no thermal indication that they have got any symptoms, they are going to go home. There's no problem. And like that only, more than 2,000 people have actually come back in the last 3 days. The point is, as a government, our strategy is to now monitor them for the next 14 days. Testing, government has got a very strict protocol, and therefore only cases where person from outside has come in and developed symptoms will be tested, and also people who are who are local and again developing symptoms will be tested. So government has given us very strong protocols. I don't have that with me right now, but we were again mentioned this in the meeting with the Prime Minister, that the testings must be done strictly based on protocol, because the kits that are available are limited. So therefore it must be used in a proper manner, and only in situations where so therefore in the last 2 weeks 5 tests have been done.
Yes, three,
About
five tests.
five tests have been done approximately.
Five.
Yeah, I'm sorry, I may be wrong, but
Five.
tests have been done, and none of them, all have come up negative. So that's the current status. But as I said, the testing labs also, and I would again urge the people also that we don't need to panic in these cases. You see, we need to it could be a common cold, it could be even a common pneumonia, it could be other ailments also. So we don't need to panic. We don't need to. The protocols will be followed, and system will be followed. We are asking people. 108 is the one-point contact for anything. If you develop symptoms you feel you want to call, please call 108. If you're coming from outside and you want to inform and want to know what you need to be done, call 108. If you need information or from the government side what is happening, what's not happening, you can call 108. So it will be a one-point contact for all kind of aspects, so that a clarity and a channel is maintained.
The health systems strengthening, that is one of the strategies that actually the government is laying a lot of emphasis, is that the first thing, actually first and foremost thing is that testing, testing capacity. So today we have Negrims, where actually this can be tested, for any suspect case can be tested at Negrims. And the other thing actually, to make this testing much easier and much more safe, we have actually trained all the hospitals, district hospitals, across the state, and also the private hospitals, how to actually take the sample, especially the swab. Any suspect case is there, you need to take the swab, basically the throat, from throat the swab is taken, and that has to be very carefully, it has to be taken, and that will be transported to the testing center. So that capacity, so we have trained all the doctors especially for taking the samples and also sending this at the Negrims facility. This is one, doctors have been trained, and then we also have trained all the doctors of the state, all the facilities what we have on the protocols, like especially what is this coronavirus, how this can be treated. The protocols includes like a screening of those patients, what are the symptoms, how actually to define the case, when actually this can be said that this is a suspect case and this needs to be tested in a testing center. So in all those case definitions we have given trainings to all the doctors, and that's another capacity that we build. And the second thing, in case there is a suspect case, basically the protocol, as per the protocol, what we need to do is that we need to isolate them. So isolation is a very, very important thing. So that isolation, that actually we have actually scaled up this isolation beds in the state. So there's again 102 isolation beds have been identified. In fact, we are in the process of even identifying more and more isolation facilities. That's another capacity, especially we call it like a surge capacity in case of a large number, actually where actually we can keep these patients. And that's another thing. The other is again procuring additional the ventilators, so that in case of critical cases, how actually that can be treated. So this is again the overall the capacity that actually we have been set up, and it's again on a daily basis we are monitoring and improving it.
And we are actually doing this to create awareness. A lot of people feel that it's a lockdown, and why is the government doing this? I want to tell the citizens of our state, it is absolutely not a lockdown. We are in fact calling tomorrow Coronavirus Awareness Day. So the idea is that let us all leave everything and let us all focus and give our attention to what this is, and try to ensure that we educate our children, educate our family members, educate our locality, and really find ways and means to ensure that simple awareness programs like washing your hands properly, maintaining hygiene, maintaining social distancing, and maintaining, not going to crowded places. I think this kind of awareness needs to be given. A lot of people are aware, but sadly a lot of people still are not aware. I think people are not taking enough measures to be careful, and we felt that one day, if we close down everything, I think it would send that seriousness message to everybody. At the same time, I would like to tell people it's not something one should panic. In a situation like this, as I said, very, very simple steps can be very, very important. And therefore, as I said, all the measures that I mentioned to you earlier, if those are followed, I think a lot of the spread of the virus can be neutralized by simply stopping the transmission chain. And at this point in time, for our state, the first strategy that we are looking at is tracking the transmission chain and breaking the transmission chain. If we are able to break the transmission chain, we will be able to stop the spread of this virus. And that is also a strategy that is being done at the central government level. Second pillar of our strategy is going to be strengthening of the health system. No system in the world today, nowhere, and even in the most developed countries, is in a position to be able to tackle a stage 4 kind of a situation. Luckily, obviously, Meghalaya is still technically at stage 0 because we don't have any detected cases. But the important aspect is we need to ensure that as a state we should be prepared as far as possible in terms of our health systems that are there. So therefore, the second pillar of our strategy is to ensure that we strengthen our health systems and ensure that whatever facilities are there are properly activated and are ready in case a situation arises. So therefore, we are taking those measures. That also includes ensuring that the human resource, that means that the medical officials are also trained and sensitized in a proper manner. The administration must be also ensure that it is responding. So that will be the second pillar. And third pillar, which is very important for us, is the community capacity building. And in this, we would want that in this kind of an aspect, the community involvement is very important. And therefore, in a society like ours, we would like the community, which already is very, very active and very involved in different kind of social issues that are there, and the different kind of even governance aspects. So therefore, I think the community will play a very important role, and mobilizing the community to really spread the awareness, to maintain calmness, no need to panic, and at the same time, but be very, very responsible and careful. I think is the message that we want to give, and the community capacity building will be important. There is no shortage of any kind of essential commodities. There is no need for any kind of buying large quantities of food produced or anything for any household or any community. Tomorrow's program is just a 24-hour program. Day after tomorrow, 2 days later, things will be back to normal. But we still advise social distancing and avoiding crowded places. But there is no need to buy additional food items. And at the same time, as I said, the supply of food items and other items is very much there. This Act has also been activated, which we are ensuring that any of these activities that are done by any individual or any organizations, action will be taken against them. Even the Consumer Act also has been activated. Therefore, I want to inform through the media to the people of the state and also to the different shopkeepers and wholesalers that if we find any kind of hoarding or if we find any kind of instance where public is being overcharged for essential commodities, strict action will be taken against those shops and against those wholesalers who are going to cause inconvenience to the people. So I must make this very clear, and if there are any such cases, I would urge the people to kindly inform us, either through the deputy commissioners or through any of the officials that are there, especially in the Food and Civil Supplies Department. But you can obviously inform the deputy commissioner's office would be the best place. So therefore, we want to send this message also to everybody that we will not allow any shops or any wholesalers or any kind of suppliers to overcharge the people. Today also we received some complaints and we are taking action against those complaints also. Apart from that, there are many things. I don't know if I'll be able to go into all of those aspects. But at the last, I just want to tell everyone that this is a serious situation globally. We are lucky that this has not reached to any kind of a serious stage for us. But the only way to ensure that we are, safe is to ensure that we take precautionary measures. We cannot be complacent. We cannot take it easy, and we need to be very, very careful in the way we handle the situation right now. If situation is handled properly at this stage, we will see that things will be under control. And that is what the objective of the government is. I urge the people of the state to also support us in what we're doing, understand that the steps are being taken for the good of the people and the society and the state as a whole.